Hey, Sullivan County, this is Kat Scott, and I am bringing to you the very first episode in my chat series, Chat with Kat. I speak with Carol Ryan, who is the former Director of Public Health for Sullivan County, and we discuss the Certified Home Health Agency and its vital role in Sullivan County, in a community like ours that is underserved, underprivileged, that is aging, and that is very rural. So please, it's about an hour long. Please watch it you can. It's an important topic. We all need to understand how this service through public health benefits us and why we want to keep it under public control, meaning why we want the county to retain control of it and not let it out as a lease option to a private company with the Sullivan County Adult Care Center or the Care Center at Sunset Lake. These are important issues for you to understand. These are your elected officials. They're making decisions for you without providing you with enough information as to why, how, and other questions. So please, I implore you to watch this, stay informed. Carol's brilliant, and we cover a lot of topics. So please. And if you have any questions, feel free to ask them in the comments down below or to reach out to me directly. I'm happy to answer any questions at any time. Thank you.
Hi, thank you so much for joining me today, Carol. For anyone who doesn't know me, I'm Kat Scott, girl about town. And today I'm going to be talking to Carol Ryan, who is the former Director of Public Health Services and currently sits on the advisory board. Correct, Carol?
That's right.
Okay.
Yes.
So when did you start with public health?
Oh my goodness. I started working at Public Health in 1988, and I worked there until 2013. I started out as a nurse making home visits. I did some clinic work. You know, we had clinics more then than they have now. And then I became a supervising nurse. I worked in the epidemiology program. I ended up as director the last 13 years that I was there until I retired from county service after 25 years.
And what's your educational background?
I'm a registered nurse. I've got my bachelor's in nursing and I've got a master's in public health, in health policy and management.
Okay. And what we're talking about specifically right now, because the Sullivan County Legislature would like to take the Certified Home Health Agency from public health and bundle it into a local development corp with the care center at Sunset Lake to be leased out to a private entity for management. So can we talk a little bit about what the Certified Home Health Agency is and how it services the public?
Yeah. And, you know, I'd like to clarify, a lot of people they don't recognize the term CHHA or Certified Home Health Agency. So a lot of people are not aware that when they've gotten out of the hospital and had a public health nurse come to visit them, that it was the CHHA that was providing services. They just knew the public health nurse came. And I think it's really important for people to realize that this thing that sounds kind of nebulous, or it's called the CHHA, Certified Home Health Agency, are the very services that most of us know somebody to have received or have received ourselves, where the public health nurse comes out, whether it's after hospitalization and somebody needs dressings changed, their wounds observed, or they need therapy. I'm gone from there, but I'm still on the board. So we provide therapy, physical therapy, occupational therapy, home health aides. So people get out of the hospital, they're weak. They are in a state where they need a little help to become independent. And it's a service provided by the county, and it's public health nursing service. Also, not just after hospitalization, they also see people who may have a new diagnosis. Say you just became a diabetic and you need insulin and you have no idea how to inject it, and especially for people with that their health isn't so good and they can't get out and they're homebound. Imagine having a nurse pull up in your driveway. You're feeling weak, you don't feel so good, you're unsure, you're scared about doing insulin. They come in, they test your blood sugar, they teach you how to test your own blood sugar, they teach you, they reassure you, they make you feel like it's not so bad, you can handle it. and they stay with you coming during the week until you become independent with it. They stay in touch with your doctor. They say, this is how her blood sugars or his blood sugars been. This is how they're doing. We think they might need additional help with this or that. And they support Sullivan County residents all the way through until they're either independent with their care, or if they're too sick and need to be moved into a skilled nursing facility, help with that process to get them there. So, and not just that, we see people there, what we always say, from cradle to grave. So teen moms who need a lot of support and help, might be 15-year-olds, they're having a baby. That child will be at very high risk. We get in there, we visit those young girls, we help them through, we make sure they're doing the best thing for themselves and the baby. We monitor the baby, we help them be a new mom in a healthy way. So there's so many different things that people don't realize are involved in the CHHA, Public Health Nursing Service.
Yeah, and full disclosure, my mother benefited from these services for many years. She was disabled. She lived in Fremont, which is the edge of Sullivan County. It's really rural. And when she was hospitalized quite frequently, and we would follow up with the doctor within 48 hours of her discharge, her doctor felt like she needed a little extra help on numerous occasions. And the nurses would come in. And I always called them the visiting nurses. And the nurses would come in. Sometimes it would be physical therapy. I think towards the end, they would have like a certified nursing assistant who would come in sometimes. Right. And that helped her. That helped her stay in her home, which was more beneficial to her on an emotional level, on a cognitive level. And we found it really helpful. And especially my mom was disabled for a long time. So she was Medicaid dependent for a long time before she reached retirement age and received Medicare. And it was really hard.
It's reassuring for the family too, to know that they've got somebody they can pick up the phone and call and say, this is what's going on with mom. You know?
And there were several times when the nurses would reach out and call me. And they would say, look, this is what's going on, or I'm slightly concerned about your mom. So I called the doctor. And it would help because my mother was not at a place where she was considered incompetent, but she was not really 100% competent. Yeah. The medical definition and the legal definition sometimes are not, don't go hand in hand. And that was great because they were really looking out for her best interest. And I always found them to be lions. Very protective over their, lionesses, very protective over their patients. Right. And it was really helpful. So if Nancy McGraw spoke in front of the Health and Family Services Committee yesterday, which was Thursday, September 10th, and she spoke about the services that they are currently providing. And it sounded like quite a bit. Quite a bit of visits, and actually I should have written it down. I had written it down. I think it was like in July. I was reading the July report. It was like 700 visits. Yeah. And I think they had 114 new cases in July. And Nancy was explaining to us that because of COVID, there was a drop in patients for a while because people just didn't trust anyone coming into their house, and that the public health nurses worked very hard on educating people, because one of the things that we know, one of the things that you probably really know and that we're learning in the public is that people have been dying because of COVID, not because they had COVID, but because they were afraid to receive medical care for a condition that they had, because they were afraid of contracting COVID. So people perhaps having strokes or heart attacks, they were ignoring symptoms or prolonging treatment. So that's another thing that the visiting nurses really help with.
Right.
It's kind of a stopgap for folks. So it's important to get them in there. So, they did this whole education program on how they were, and these are folks who were putting themselves on the line too, because they're going into people's homes.
Right, exactly. They're taking a risk themselves. So, the public health nurses are altruistic. They really care about the patients, and so do the therapists and the aides. They do put themselves second. They put the patients first.
Nancy was also talking about the COVID testing that the nurses was it people from CHHA who were helping with administering?
Yeah, so
samples?
here's the thing, and the benefit to not separating out the home care, the visiting nurse service, is that those nurses can be deployed. Think of it as like an reserve corps. They can be deployed when needed in other areas. So when there's a massive health emergency, they can be pulled away to do emergency vaccination clinics, for instance, or do emergency testing if there's a tuberculosis outbreak or something like that, and they have to test so many contacts. One year, there was somebody that worked in a bar and had contact with thousands of people by the time they got diagnosed with having tuberculosis. And so there were so many people that had to be tested for exposure to tuberculosis. And something like that, you need to pull that core, that core of people that generally does home visits but can be deployed for other emergency uses. Where if the county was to go ahead and privatize the home care, those nurses would not be available to be deployed in that way because they'd be managed or leased or run by a separate entity. So in order to provide the kind of quality of care for these other circumstances, public health would have to hire a whole bunch more of nurses. And there are other visits that have to be made under public health law that now it's getting a little complicated, let me try to make it simple. There are visits that have to be made whether a county health department runs a CHHA or not. And they are to the high risk mothers and children, infants, children with lead poisoning, anybody who's at risk, like the teen parents or babies that are having failure to thrive or other things. Or if you have an adult or any age person with tuberculosis, they are, by law, ever since we had a multi-drug resistant tuberculosis outbreak in the country, people, when they get diagnosed with tuberculosis, have to be observed to take their medication until they're no longer have TB. And that's to prevent, because when you're on a drug for months or up to a year, you start feeling better. It's just human nature. You're going to forget to take a dose here. You're going to forget to take it there. You're going to say, right, can't get to the drugstore. And then you end up with an organism that's resistant to so all these visits would have to be made. And whereas under a certified agency, you can actually bill for these visits under Medicaid or Medicare, you can't bill if that's separated out and the county's just doing that with a license to do these high-risk visits. So as I was at the legislature yesterday and I was explaining that the return on investment that they anticipate may not be as great as they're hoping.
So by separating out the CHHA, they could actually be cutting revenue for themselves for some things that they're legally mandated to do.
Exactly. I mean, they're not, that revenue helps offset some of the other costs that are not reimbursed. They get some state aid money. The taxpayers do pick up a piece of the services. That's what you pay for when you pay taxes, is for services.
Right.
But they have a lot, they get reimbursement from Medicare, Medicaid, and private insurance companies for these services.
So for example, let's talk about rabies, because it always surprises me when Nancy talks about the number of incidents of rabies in Sullivan County. If you are bit by a feral cat and you can't find that cat, public health has to step in because of the risk of rabies, correct?
Right.
Because
right. If they can't find the cat to either confine it or to test it, they have to assume.
Right. Or a bat. If you suspect that a bat may have bitten you and you do not have the bat to test, public health has to step in and administer treatment.
That's right.
And is that legally mandated?
Oh yeah. Yeah.
Right. So that's part of what our tax money is paying for, is that when you come up against this situation that is bigger than you, that we have a safety net, not to protect you, but to protect the greater good of the community. And that's where the clinics come in too, right? Because I know There's rabies clinics throughout the county all the time, trying to cut down on the incidence or the risk of rabies because of the greater public good.
Right, because domestic animals are your buffer between wildlife and you.
Right.
So if your domestic animals are protected against rabies, you have much less chance of being in contact with a rabid animal directly.
And I think a lot of people kind of have an idea about this, but I think we're very fortunate that we don't come up against this often. So it's kind of out of sight, out of mind. And when we're talking about what the taxpayer is paying for, you're paying for a safety net that's there in case you need it and to protect you so that you don't need it.
That's right.
Because it's shocking actually to hear about tuberculosis, because I think one of the things that COVID is teaching us or allowing us to experience is what it's like to live through a infectious disease emergency. And we don't think about tuberculosis or polio, or I mean, even last year with the measles, I think a lot of us were kind of like, oh, okay, like I got my shots when I was a kid, so what's the big deal? Because we had the medical technology from the past that solved a lot of these questions and problems. But when I hear about tuberculosis, I'm like, oh my gosh, that's still around.
Still around. And measles, by the way, measles is one of the most dangerous communicable diseases there is. So there are people that still get measles, obviously.
Right.
For whatever reason, either they're too young to have been vaccinated, or they just didn't get vaccinated or didn't get the double doses, the 2 doses.
Right.
It's a very serious disease. Can lead to meningitis, all kinds of other problems. It's in refugee camps, measles is usually the disease that kills most children of any other infectious disease.
But for us living here, I mean, in this country, we're pretty lucky. We're pretty fortunate that we don't face these things. So when we're talking about public health and public health management, sometimes, we need to have these discussions so that we do know when the taxpayer is investing, what they're investing in. And that's a safety net. Because I do remember my mom was in and out of the hospital a lot last year. And because of the measles situation and the outbreaks that were happening, there was that sandwich board. Every time I'd go into the hospital, that was like a warning. And that's important. All of that stuff is important. We've taken so much for granted. So when we're talking about the CHHA and we're talking about putting it into a nonprofit entity that is run by a 5-person board, to choose a management company to lease the CHHA out to, it's a little scary for some of you guys who know the full impact of what it will have on the public health.
Yeah, and for people like your mom, I mean, these agencies, the further they have to drive out to see patients, the less profitable that patient is to them. And, I'll say it diplomatically, but they have to look at making a profit in order to keep operating, whereas it's a public good for the CHHA. If it's provided by the county, those things get equalized. So even if you live far away, or you have a condition that requires a lot of nursing care, therefore, if you're not as profitable, it doesn't matter. Your life and your well-being come first before the bottom line. And that's the difference between a public CHHA and a private one.
Do we have any other CHHA services in Sullivan County?
There's a couple of certified agencies, but they are what's called special needs CHHA. So they had to apply, they had to go through the certificate of need process, and they serve a very small specified population. I think one, and I don't even know how active they are in the county. I think one is for mental health conditions. The other, I don't even know if they're, I don't want to say anything that isn't correct. So it's been years since I looked at who it was, but they had a very small presence in the county, and they can't serve the general public.
And they're not based in Sullivan County.
No.
I think that's what I've read, is that they're not based in Sullivan County.
Yeah. Yeah.
Okay. So one of the things that that we've also talked about is the legality of doing this. And I think that the counter argument is that the child's not being sold, it's being leased.
Mm-hmm.
And that's not part of what the health department law is. But there is language in some of these resolutions that does talk about sale. Can you talk a little bit about that, about the legality of selling a CHA, a public CHA?
Yeah, I mean, what you have to do if you want to sell a CHA, you have to sell the certificate of need. There's something called a certificate of need. It's a big process you have to go through, and it has to be Department of Health approval. And there are very high standards to meet. You have to prove you can meet those standards. And you're still not selling the public part. You'd be selling the certificate of need to open a private CHA. The public responsibilities remain with public health. You can't sell that away or give that away.
So separating the CHA from public health is really just kind of handing a little bit of a blow to the public health department.
A big blow.
Big blow.
A big blow.
Okay. One of the things that the county attorney mentioned during the organizational meeting of the Sunset Lake Land Local Development Corp meeting on September 3rd was that they were bundling the CHA with the nursing home with the understanding that the CHA would feed the nursing home potential residents. But that's problematic for a couple of reasons, right?
Yes.
One reason it's problematic is because the CHA has always helped people find long-term care when they've needed it.
Right. Always preferential. Well, first of all, people have a choice. You can't tell people where they're going.
That's another thing that's problematic, is that people in New York State still are covered by the New York State Patients' Bill of Rights, and they still have the right to make their own decisions as far as their care goes.
Exactly.
So like when my mom, she had a small stroke, she needed rehabilitation care. We had tried SNU, and SNU denied her because they said she had dementia. They didn't have a lockdown facility, even though my mom is 3.5 years later, still not in a lockdown ward. Mm-hmm. But when we went to the care center at Sunset Lake, when she finished her rehab, we could have chosen to put her in long-term care at any other facility, if that was our decision. So saying that the CHA would be added to the care center in this LDC to make it, and I believe these are my words, make it more of a desirable acquisition for a management company just doesn't really make sense.
It makes no sense whatsoever. For a couple of reasons. First of all, as a county-run facility, when the nursing home, the skilled nursing unit, skilled nursing facility is still skilled nursing and still run by the county so far, county residents have preferential admission should they want to go there. Because they put in their press release that the reason they're doing this is so that they will get preference as county residents. It makes absolutely no sense. And the other thing is, do you really want the CHA to be encouraging people who might be better off cared at home or happier at home to go into a nursing home to increase the bottom line for this company? I mean, you still have to qualify to be in a nursing home, but the whole idea just doesn't seem right. Let's put it that way.
Right. And that's been one of our arguments about the care center at Sunset Lake. Right now it is a county owned and managed facility, and Sullivan County residents get preference.
Right.
We know that Sullivan County is a county that is aging and has a higher average poverty level than a lot of other places. So when somebody needs long-term care, and if they don't necessarily know how they're going to pay for it, they're accepted and they help them figure it out.
Right.
We're being told by some of the people in the legislature who are pushing this that, they can reserve a certain amount of beds. Well, right now we have 146 beds reserved for Sullivan County patients,
Right.
residents. So it's very problematic, the
Right.
whole thing. But the CHA aspect of it just really seems, honestly, it came out of left field. I was in the meeting on August 13th. It was a special meeting of the legislature. I believe CHA was mentioned once. I've gone back and looked at the video, and I believe it was mentioned once. The meeting happened. I was not happy about the meeting because I've called it a smash and grab. It was like witnessing a crime in broad daylight. And when I got home, somebody reached out to me and said, Kat, what happened with CHA? And I said, I don't even know what you're talking about. And I didn't even know what CHA was at the time.
Yeah, a
I
lot
don't
of
even know what you're,
people, as I say, don't know what CHA is. You have to explain. And
right,
then they realize, I know what that is. We had the nurses come.
right. And that was the exact conversation I had. And I said, no, nothing happened with the CHA. And they said, it's in the press release. And I had to go to the press release to read what had happened, even though I was in the room
Right.
and I witnessed it all. And I've since heard that I'll quantify it better, that there were at least 4 legislators who did not recognize that that's what was happening on August 13th. And the following week on August 20th, that's when they came back with questions and they weren't happy.
Hmm.
So, and they're, like I said, they're justifying this by saying it'll be a better acquisition for a private management company. Meanwhile, as you know, the care center does not need to go into an LDC in order for a management company to be hired. The county can put out an RFP, a request for proposal, and somebody can pitch them how they'll help turn it around and what it'll cost. And I've been told by people who have worked in long-term care in administration that it does not necessarily cost to the county, that this company can work it all out within their finances of how they're going to get paid to do this. We've seen 3 audits, and each of the audits have told us where they need to improve. Bring up your census, look at your patient mix. Your short-term rehab is where you're going to make your money. Anything that a private entity is going to do, and with CHA, I just don't. Having somebody privately manage it, I see services going in the opposite direction of what they're saying is going to happen. Like I said, my mom's house was in Fremont. If someone's living in Fremont and they need a nurse to come and check on them after hospitalization and do their meds and just whatever else needs that patient needs, are they going to be sent out to do that? Especially if their next stop is going to be in, gosh, I don't even know. Let's say it's over in Youngsville. Are they gonna or are people going to be denied?
Yeah, that's
Actually, I don't even know. I mean, can they deny people? I mean, how would that even work?
I don't know how it's going to work because it's never happened before here. I mean, private CHAs can deny people. So, yeah, I don't know. My other question I have is, so if they're paying a management company to manage it, and they have people managing it, and the county is promising that nobody will lose their job, is that just an extra cost? They're going to have an extra layer of somebody they're paying above the existing managers to manage it.
Well, they're saying that it's a lease. They're leasing these agencies out. So now an agency, a company is going to come in and lease this facility. So now they're looking at the expenses of the facility and some kind of lease on top of that.
Yeah.
What are they going to do?
What management consist of will just be saying you're going to spend less here, you'll spend less here, you won't do this visit here, you're going to discharge this person here. Not really management of the nursing staff or the therapies, but it'll just be, and I'm asking, I don't know, will it just be in terms of expenditure?
I don't know.
This is costing too much, stop doing this. I don't know what that would look like.
Neither do I, because now not only do they have the expenses that the county has, but on top of that, they're leasing.
Right.
So they're going to have to make up. And now I know that some of the legislators were well-intended when this solution popped up. They thought that they were doing something. They thought they were doing something good. And you heard my public statement yesterday. I'm very frustrated because the conversation was, well, the public wants to keep it. This is something we value. So why don't we try and turn it around? And that was a suggestion, but the actual conversation about turning the facility around never happened. There was one meeting that happened with Nadia Reich, who's the chair for Health and Family Services. Robert Doherty was there, the chair of the legislature. Joe Perillo was there, and so was Louis Alvarez, along with the administrator of the Times, Rita Alexander, who has since left. I believe Stephanie Brown was there. Josh Potosik was there. The union was there. I mean, they had a sit-down talk about what they could do. It was a 2-hour talk, and none of it was public. It was just, let's try and get our bearings. And then before you knew it, within an hour of that meeting ending, that's when an email went out that they were trying to eliminate 20 positions.
Wow.
So that became the new conversation. Was, you want to get rid of 10 CNAs, 4 domestic aides, everyone who works at the front desk, and your financial administrative officer.
Wow.
A conversation about what the county could do to improve the finances of the care center never happened, not with the intention of doing it. And this whole lease idea was born, and there was a huge rush during the August 13th meeting. Nope, we have to vote on it today. Nadia said, can we look at it and discuss it next week? Nope, it's got to happen today. Michael Wire was typing it up during the meeting.
Wow.
Yeah. So I was actually really impressed with Nancy's presentation, and I was like, gosh, if the care center had someone like Nancy McGraw, or somebody who was able to take the reins like Nancy has as the public health director, we would be in great shape. And one of the things that I've found, and I say this all the time, so if people are sick of hearing me say it, I do apologize, but I'm going to continue to say it. The dedication of the county employees is incredibly inspiring and admirable. You were one of them. You don't do it for the $1 million because you're not making $1 million. You're not doing it for fame or fortune. You're doing it because you have a dedication and a love of community.
Right.
And a lot of what's happening out in Monticello is really trying to find the right words. Really, it's beyond frustrating.
Mm-hmm.
It's infuriating because it seems disrespectful to people who dedicate their careers to help the community, to better their community. And I don't understand why. I don't understand what any of this is about. We know that COVID is a crisis. We know that COVID is affecting everyone financially. But we also know that in Sullivan County, the original projections are not as dire, right? So it was very doom and gloom, but now we know the sales tax wasn't as bad as originally projected. The casinos opened again. People are buying houses up here like crazy.
Oh, like crazy, yeah.
Like crazy. The Airbnbs are pretty busy still. New York City has a record 13,000 empty apartments because people don't want to live on top of each other during a pandemic. Who could blame them? And they're looking to go other places, and they found here.
Real estate agent in the building that my office is in says that they can't hold on to houses. They're going flying out as soon as they come in. So it's really true. Listings
are lasting days. People are listing their houses, and my neighbor, he put his house on the market, and I think it was 10 days.
Yeah.
It was not long.
That's good for the economy in the county.
It is. We are still facing a financial problem, but their argument of how much money that the care center's losing does not hold water. There's some funny money manipulations happening. You can make a number sound, you can take one situation and make the number sound great, okay, horrible. And I think they've been doing that, manipulating some of the numbers for the care center. And they don't even have a justification for the CHHA other than be a better deal for somebody else.
Yeah, it's not a very good, I don't understand what their justification is for the CHA because it doesn't make any sense to me at all.
It doesn't make any sense to me either. And
Seems like an afterthought. So I think somebody said to them, well, usually when we do this kind of a deal, we also take the certified home health agency because then we'll get all their referrals. Whereas maybe they would give the referrals somewhere else without us owning it. But it doesn't make any sense here.
It doesn't.
This situation.
It doesn't make any sense. It really doesn't make any sense for the residents and taxpayers of Sullivan County. I don't see how we're going to, I mean, first of all, and I've said this about the nursing home, you know, we've been building and paying for this service forever. So now all of a sudden something that we've created and nurtured and maintained is now going to go somewhere else. Mm-hmm. You know, someone else is going to be billing for it. And who are they billing? They're going to be billing us for it, or they're not going to be serving us. I just don't know how that makes any sense. So we went from having a service that anyone in Sullivan County was able to participate in to now, if it goes to private management, maybe they won't go out to Fremont Center. Mm-hmm. And there's going to be probably limits depending on insurance. You know, if insurance decides that you only get 3 visits, then you get 3 visits. It doesn't matter if the condition requires 10 visits. They will give you the 3 visits and then that's it. That's right. And the billing, you know, they're going to be making money off of us. Mm-hmm. I mean, and if I'm wrong about any of this, please correct me, because to me, it just doesn't make any sense. I've sat and I've thought about this very long and hard, and
I mean, there's another thing. There's no CHAs that are fighting to get into this county and purchase the operating certificate from public health because they don't see this as a tremendously profitable operation here because of the fact that it's 1,000 square mile county. You know, it's expensive for anybody to run and serve everybody. And they have to look at their bottom line. So there's a reason there's not all these companies scrambling to purchase the operating certificate for the CHA.
And that's what we know about business, right? Is supply and demand. If there is demand and somebody has supply, they'll show up and supply it. And you're right, there isn't a healthy competition for this service. There's more. The deeper I dive into this, the more questions I have. And my questions aren't getting answered, and it just doesn't make any sense to me. And that's why I wanted to talk to you, Carol. And you guys, a lot of people from public health have been speaking out about this. Mm-hmm. You're the director of public health before you was Diane Campbell? Diane Campbell. She submitted a public comment, and you had shared it on Facebook, and I saw that, and it was brilliantly written. And she was talking about was it Gladys
Olmsted, who was the very first public health nurse who started, got the certification, started the public health nursing home, certified home health agency.
Okay. Do you know what year that was?
Public health before the certified home health agency started. The certified home health agency has been in operation 47 years, by the way. Must be doing something.
Wow. And in her letter, she talked about the fact that Gladys was working in a dirt floor room in the basement of the courthouse.
Courthouse, right. That was the very first public health office, nursing office. Yeah.
And now we see that the CHA, the visiting nurses, have made like 500 or 700 visits in the month of July. I can't remember what it was. I apologize. I should have had those numbers. But that's impressive.
Right.
That's really impressive. I mean, even in just 47 years, to go from working on a dirt floor in the basement of a courthouse to spanning out to visiting residents no matter where they live in the entire county and offering clinics and education and all of the work that goes through with this.
Right. I mean, there's a reason that physicians make referrals to public health, and that's because the patients have better outcomes because of the services of the nurses, and therapists, and the aides. People do better. So it saves money for the whole healthcare system.
Right, and that's a lot of what Nancy was talking about yesterday. Was the and so one of the things that has bothered me is that when we in meetings when discussing transferring CHHA into this LDC, and I believe it was Nadia Reich. Well, Ira Steingart mentioned it once that he was under the impression that it was not legal for them to transfer the CHHA into this LDC for sale. And he said he'd spoken with Nancy McGraw. Nadia Reich echoed the same thing. And Mike McGuire said, well, if you want a legal opinion from a nurse, I guess you ask a nurse, which I found incredibly disrespectful. Because Nancy is the director of public health services, and she is not a nurse. First of all,
consulted with the state health department.
Yeah,
she consulted with the expert legal authority at the health department, who said that, I'm paraphrasing, I could be wrong, but I think they said they never heard of leasing out a CHHA.
Oh, that's interesting. Well, that's interesting. So I just want to go back to, first of all, who cares if she is a nurse?
Right.
Nurses are educated, hardworking professionals.
And they're the most trusted profession for the last 18 years of any profession in the country.
Well, there's
Now
that.
The public perceives nurses.
So I wonder, where do you think lawyers fall on that range of trusted professions?
Oh, I don't know.
Probably somewhere below nursing. I just found it really disrespectful and condescending. And just to go back to Nancy McGraw, Nancy McGraw is not a nurse. Nancy McGraw is a licensed clinical social worker. She has a master's in business administration and a master's in public health. Is it public health administration?
She's got her
Public health.
master's in business administration. Her master's. Oh, I'm forgetting her MBA in health administration. Okay. So master's in business administration and healthcare administration, and her master's in public health.
So that's 3 master's degrees, right?
That's right.
So in order to become a licensed clinical social worker, you have to have a master's degree. So that is 3 master's degrees. So Nancy McGraw was speaking to a legal profession within Department of Health, which would fall definitely within her range of education and professional experience. She probably understand what they were saying to her.
And it's her responsibility to check these things out. I mean, she is the legal, what they call the health officer for the county. Somebody in that position can't be appointed by the legislature unless the state health department approves that person and their qualifications and their experience. Another can't be a political appointment.
Right.
So the legislature may want to appoint somebody, but that has to be approved by the state health department so that person in that position has the right qualifications and the right experience to do the job. And she has access to the legal authorities at the state health department who know these things or will research these things. The state health department and the local health department have a very strong partnership. They don't just provide oversight, they're partners. So even things that are local decisions, they will partner with the counties and they will advise them legally. And if they have to get involved, they get involved as well.
Okay. So that answers that question. And in another video, I'll talk about this a little bit more. I don't think it's fair, Carol, for me to include you with my personal beef with Mr. McGuire. Because sometimes sitting in these meetings, I do take offense for other people, the way things are said or actually what's literally being said. But I did want to make that point of clarification, is that Nancy McGraw is a highly experienced and educated woman who has this position because she's earned it. And that's recognized now by the state. You've just told us the state Department of Health is the one who has to sanction her appointment. So when she's talking about things, and really, I mean, she's been working on COVID for months now, managing this crisis and deciding, working with the superintendents about how school's going to open on top of all of her other duties. So I think we can all say that when Nancy looks into something and comes back with an answer, that it's probably a pretty good answer.
Right. Right.
Is there anything else that we want to talk about, just so the public understands all of that they have at stake? Because the public is the one who has the most skin in this game.
Well, I mean, the only thing I would say that is right now, currently the way it is now, that should you need any kind of nursing, therapy, or home health aid care, you're guaranteed to receive it. And because the service is here, and it's here to serve everybody in Sullivan County. It serves all the public without prejudice, without any kind of conditions other than you qualify and you need the care. So that's something that county residents can depend on, feel safe about and comfortable about, and have absolute confidence in the quality of the staff that's going to show up at your house or your loved one's house to take care of you.
Yeah, it's good stuff. And it's not an abused service. There's a lot of oversight. There's a lot of requirements.
Right.
Doctors have to prescribe it. Nurses have to answer to a higher up to justify the visits. This isn't something that's being abused. I think often sometimes when we talk about what the taxpayers are funding, people feel like the systems are abused, but this is not something that's being abused.
Yeah. And I don't even think, I mean, I've never heard that out in the community, that people feel that public health is abused.
I've never heard it either, but
it could be me, it could be any of us that need something. It's sort of, it levels the playing field, our health and our well-being. We all have bodies and things can happen to any of us.
Right,
and it's
because
nice to know that service is there.
With this service, everyone matters.
Everyone matters. Yep.
Everyone matters. It doesn't matter what your income is, what your last name is. It doesn't matter where you live in Sullivan County. All it matters is that you need help and you live in the county of Sullivan, and then visiting nurses show up and they do what needs to be done. I've never heard anyone complain about it being abused, but I figure while we're having this conversation and we're putting it out for public consumption, just in case that does come into somebody's mind, this isn't something that's being abused. It's need-based, that it is, there's a lot of oversight and regulation to it, and that it really just serves the public good.
That's it.
How much of it is elder-based? Because that was another discussion that happened yesterday during the LDC meeting, the Sunset Lake Local Development Court meeting, was that if you take CHHA and put it into this LDC, it's not just elder care that you're taking. You're taking a lot of other services. So how much of it is elder care? That would lead, so just to go back to their argument, that the CHHA is going to funnel residents into the nursing home. Mm-hmm. So we're not just talking about elder care based on age. We're talking about people who are at a stage of their life where they are not able to live on their own or take care of themselves, or can be cared for.
They might have a chronic disease or a new disease, which is not age-based. I mean, yes, as we get older, we have more things happen to us. And yes, I mean, at least when I was at Public Health, I haven't looked at the breakdown recently, but the majority of reimbursement was Medicare, something like 75, 80%, but not all of it. And all, like I said, we serve cradle to grave. So
right.
Babies, children, pregnant women, women at risk who are having babies, any age people that have any diagnosis where they need help and support to become independent in managing their illness. But of course, like anything else, as we get older, more things happen. So a large percentage, but not the overwhelming percentage, not 95%, not 99%.
Right. So there is a section of people who have needs that may not be met because they don't fit the profit criteria of a management company. So I
Yeah, I
guess
mean,
they're
it's
just
all
out of
very
luck.
uncertain. None of us know how it would work. And that's a little bit the scary part, because once it goes over to this company, I don't know that as Mike McGuire would say, I'm not a lawyer. I don't know if you can take it back afterwards when things are being managed poorly. I don't know how that looks, but it is a little bit scary to think that they no longer will have the control. And this company, the reason they're making decisions is not because it's a public good, but because they've got to look at the bottom line. It's their primary, and they got to bring a profit in. So,
And there has been no public discussion about this.
no public hearing.
No public hearing. And yesterday in Health and Family Services was the first time that this actually had a public space where we talked about it.
Yeah, and I might say, as I said yesterday, I feel this kind of strongly, especially now in our remote environment where we're all doing everything from home. There should be a public hearing, in my opinion, and the public should have the opportunity to remote into that hearing and make their testimony over whatever remote means, whether it's Zoom or phone, I don't care, but it's hard. Look at the two people that spoke. One of them was in her 90s, people that received services. One was hobbling with a cane because she's had multiple surgeries. And they dragged themselves, exposed themselves to possible infection with COVID, even though they're vulnerable, dragged themselves because they felt so passionately about it. They wanted to testify to the legislature how important this service is. I think it's unfair to not allow people that are residents in the county to be able to call in or remote in during a public hearing. We're remoting in for everything else, for school, for work. Why not? And, I think watching the legislature, when I mentioned that, I couldn't tell what they were thinking, but they looked kind of open-minded about it. I mean, they looked like they were really listening. So maybe they would consider that. Maybe it just hasn't been thought of because it's never been done before.
I hope so, because when the public comment was available for the care center at Sunset Lake on July 14th, we had a lot of people show up. They had allotted us 30 minutes, and of course we had more than 30 minutes. People actually spoke for an hour, and then they rescheduled to the 2 days later on July 16th, and people spoke for another 3 hours. So they heard over 4 hours of public testimony about why this facility is important and why the public wanted to keep it. And that's a lot of people in the middle of an infectious disease emergency that is airborne. People wore masks, there was social distancing, but it was still a lot. But that's how strongly people felt about it. I mean, frankly, I came out and I have been quarantining pretty hard until this whole thing started with the county. I work from home. I wasn't going grocery shopping. My boyfriend is the appointed errand person. And it took a lot to get me out. And you're right. People should have a choice. Right. Especially since we're seeing a little bit of a spike in the county right now. School's just gone back, so that we could see a little bit of a spike from. And, just to keep everybody safe, it should be an option. People should have a choice instead of potentially risking getting sick, to come out and talk about how they want to stay well and what we need in this county for us all to stay on a wellness track. Briefly, I do want to talk about this because this has been in the news for the past few years, and that is the fact that Sullivan County was 61 out of 62 counties as far as health in the state, and I believe we bumped our way up to number 60. I think we're second to last, or third. Yeah, second to last. Well, however you want to phrase it.
We were at we went from 61 to 60.
Yeah.
It's a small change. It could go back down depending on how they're looking or how the other counties are doing, because it's a ranking. So it's not an absolute.
Right. There's a lot of variables that go into the determination. But would one of those determinations be how people are hospitalized or able to stay in their homes? Like the CHHA would have an impact on this.
Right. Well, they look at a
Essentially.
whole, I mean, you could get on the Robert Wood Johnson Foundation site and look at it. It's complex how they put all that together.
Okay.
And a whole multitude of different statistics. Some of them are over a number of years. They include environment. There's just so many things in it that it's
Okay.
hard to absolutely say that one way
Well,
or
I
the
guess to rephrase it would be that we should be concentrating more on a wellness path as a
Mhm.
community and not on ways to kind of save maybe what they think is a couple of bucks here and a couple of bucks there, because those few dollars actually impact the greater good of our overall wellness.
Yeah. I
That
mean,
would
I
be
understand the
probably
county's having a fiscal crisis, but it has had fiscal crises before. And this was never done before. So my
right.
concern is, will the harm that's being done by this be greater than the benefit that they're getting out of whatever monies they save? And I would love to see them look at other creative ways to bring in revenue, and not just go to the default that we need to privatize these services.
Yeah, that's a good point. And I've said that before in my public comment. I've said it in my videos. Sullivan County, we've known about tough times. I mean, we
Mhm.
were teething on tough times. It's part of who we are. It's the fabric of our community. Um, and like you said, we've never taken the CHHA in 47 years and tried to lease it out to a private management company. And over the last 30 years that we've had the care center at Sunset Lake, formerly known as SCAC, Sullivan County Adult Care Center, formerly known as the Adult Care Center, formerly
Right,
known as the Infirmary. It's had
right,
a lot of names, but it
right,
has remained a public asset to serve the
right.
public. And we have definitely faced tough times in the past. Now, COVID is a new challenge that, and I don't want to downplay that. COVID is a challenge, and what we're looking at financially is something that in my lifetime, I know for a fact, I have not seen or experienced before. But like you said, it would be great to see what they're doing
Okay, you're
to.
frozen now.
Oh,
Okay, so I was frozen, or you were frozen. What I predicted was going to happen just happened. We lasted a
okay.
pretty long time, but maybe we could wrap it up. And
Okay, we'll do that. So, but yeah, so it would be nice to see the county find innovative ways to bring in revenue, to generate revenue. What are we doing to drive revenue? We
Mhm.
can't just slash and burn
Right,
our services because we have a population that is underserved,
right,
not overserved.
right. That's
So,
right.
well, thank you for your time. Again, Carol Ryan, you are the former director of Public Health Services. You currently sit on the advisory board for public health. So you know what you're talking about and you're concerned,
I'm
as are a
concerned.
lot of your colleagues, former colleagues. And I know the advisory board sent a letter to be read into public comment. So it's
Yes,
not just you, it's pretty
that's not.
much. Yep, it's the whole gang. So thank you for taking the time to talk to me and explain some stuff. And hopefully people out there are listening. And if they have any questions, they can ask me and I'll ask you. And maybe we'll do a follow-up.
Okay. All right, Kat, thank you very much for
Thank you,
everything.
Carol.
Okay. Good night.
Good night.